Good evening, everyone. I'm Sundari Venkatachalam, the member of Lions Club of Bangalore, Bandhavia Lioness, and I'll be your host this evening. I welcome you all to this special program that we have organized on organ donation. Lions Club International has considered this to be an emerging necessity of today. And it has stressed on all the clubs to create an awareness among all the people that organ donation is a very, very important. It's a very important thing that one should give a thought about it, especially in countries like India, where we do hesitate to think about organ donation, because we have come a long way from heart transplant and liver transplant to kidney transplant, but there is still a lot of unknown fears, unknown spheres of organ donation, which we are not really very well, we are not aware about. So today's special program is for this month being the organ donation month. We decided to observe this day today and invite Dr. Seshagiri, a renowned neurologist and a transplant surgeon working for BGS Global. It was wonderful talking with him the other day, and I do hope he enjoys the few minutes, or rather the short time that he's going to share with us. Now, just to give you a brief introduction about our club, as I'm sure most of you are aware of Lions Club International, and we happen to be an all-women's club. So that is why we have this Lioness tag at the end of our name. So we started as a Lioness Club sometime in 2008. And we've continued for so many years as a very successful club, serving the society in and around our area. Most of us live in and around South Bangalore, Baswangudi, Girinagar, and Shankar Math, and basically the heart of South Bangalore. So all our service activities are all usually concentrated in and around this area. We have been doing a little bit, whatever we can over the years. But 4 years back, Lions Club International decided that all the Lionesses should join the mainstream of Lions Club International. So we are all not called as Lioness, but we are all called as Lions itself. And we joined the mainstream of Lions Club. And because we joined that, we do get a lot of benefits. We are recognized officially by Lions Club International, and our activities are much more widespread. And we have, whatever activities that we do, we have the blessings of the Lions Club International. So earlier it used to be only our parent club which used to support us, or the parent district. But now we are a part of the several thousands of clubs worldwide. So Lions Club of Bandhavia, we are entering this is our 4th year as Lions, but I think it will be our 13th year or 14th year as a Lioness member. So our club effectively is 14 years old, and Bandhavia was a name selected, which means togetherness, love, affection. So that is how we have been continuing. We have been together. We share our dreams of serving the society. So welcome you all to our club. And I now request our club president, Lion Rajini Umapati, to give her welcome address. Rajini, over to you.
Thank you, Sundari. ಎಲ್ಲರಿಗೂ ಥ್ಯಾಂಕ್ ಯು. ಎಲ್ಲರಿಗೂ ಶುಭ ಸಂಜೆ. ಮೊದಲಿಗೆ ನಮ್ಮ ಕರೆಗೆ ಮನ್ನಿಸಿ ಡಾಕ್ಟರ್ ಶ್ರೀ TV ಶೇಷಗಿರಿ, ಕನ್ಸಲ್ಟೆಂಟ್ Transplant Surgeon and Andrologist Global Hospital ಕೆಂಗೇರಿ ಅವ್ರಿಗೆ ಸ್ವಾಗತ ಹೇಳುತ್ತಾ ವರ್ಲ್ಡ್ ಆರ್ಗನ್ ಡೊನೇಷನ್ ಪ್ರಯುಕ್ತ ಈಗಾಗಲೇ ಆ ದಿನ 13ನೇ ತಾರೀಕಿಗೆ ಮುಗಿದಿದೆ. ನಾವು ಈ ಬಾಂಧವ್ಯ ಕ್ಲಬ್ನ ಕಾರ್ಯಕ್ರಮ ಮಾಡಬೇಕು ಅಂತ ಚರ್ಚೆ ಮಾಡಿದಾಗ ನಮ್ಮ ಕ್ಲಬ್ಬಿನ ಫಸ್ಟ್ ವಿಪಿ ರಮ್ಯಾ ಶೇಖರ್ ಹಾಗೂ ಮತ್ತೆ ನಮ್ಮ ಸುಂದ್ರಿ ವೆಂಕಟಾಚಲ ಅವರು ಡಾಕ್ಟರ್ ಶ್ರೀ ಶೇಷಗಿರಿ ಅವ್ರ ಜೊತೆ ಮಾತನಾಡಿ, ನೀವು ನಮ್ಮ ಲಯನ್ಸ್ ಕ್ಲಬ್ನ ಬಾಂಧವ್ಯದಿಂದ ಮುಖಾಂತರ ನಮ್ಮ ಜನರಿಗೆ ಆರ್ಗನ್ ಡೊನೇಷನ್ ಬಗ್ಗೆ ಅವೇರ್ನೆಸ್ ತಿಳುವಳಿಕೆ ನೀಡಬೇಕು ಎಂದು ಕೇಳಿಕೊಂಡಾಗ ಅವರ ಬಿಸಿ ಶೆಡ್ಯೂಲ್ ನಲ್ಲೂ ನಮಗೋಸ್ಕರ ಬಿಡುವು ಮಾಡಿಕೊಂಡು ಅವರ ಅನುಭವ, ಸಲಹೆ, ಸೂಚನೆಗಳನ್ನು ನಮ್ಮಲ್ಲಿ ಹಂಚಿಕೊಳ್ಳಲು ಸಂತೋಷದಿಂದ ನಮ್ಮ ಈ ಆರ್ಗನ್ ಡೊನೇಷನ್ ಕಾರ್ಯಕ್ರಮ ಝೂಮ್ ಮುಖಾಂತರ ಬಂದಿದ್ದಾರೆ. ಅವರಿಗೆ ಮತ್ತೊಮ್ಮೆ ನನ್ನ ಮತ್ತು ನಮ್ಮ ಲಯನ್ಸ್ ಕ್ಲಬ್ ಬಾಂಧವ್ಯ ಕ್ಲಬ್ನ ಪರವಾಗಿ ಸ್ವಾಗತ ಹೇಳ್ತಾ, ಹಾಗೂ ನಮ್ಮ ಲಯನ್ಸ್ ಕ್ಲಬ್ನ ಡಿಸಿ ಪಾಲ್ ಪ್ರಕಾಶ್ ಕುಮಾರ್ ಆರ್ಗನ್ ಡೊನೇಷನ್ ಮತ್ತೆ ನಮ್ಮ FWMS ಡಿಸಿ ಲಯನ್ಸ್ ಸುಂದ್ರಿ ವೆಂಕಟಾಚಲರವರಿಗೂ ಸ್ವಾಗತ. ಹಾಗೂ ನಮ್ಮ RC ಲೀಲಾಕೃಷ್ಣ ಅವ್ರು ಹೇಳಿದ್ವಿ, ಅವರು ಬಂದಿದ್ದಾರೆ ಅನ್ಕೊಂಡಿದೀನಿ. ಅವ್ರಿಗೂ ಮತ್ತೆ ZC ನಾಗಮಣಿ ಮೇಡಮ್ ಅವ್ರ ಮಗಳು ಲಾವಣ್ಯಗೂ ಸ್ವಾಗತ ಕೋರುತ್ತಾ, ನಮ್ಮ ಲಯನ್ಸ್ ಬಾಂಧವ್ಯ ಲಯನ್ ಅವರೆಲ್ಲರಿಗೂ ಸದಸ್ಯರಿಗೂ ನನ್ನ ಸ್ವಾಗತ ಕೋರುತ್ತಾ, ನಮ್ಮ ಈ ಲಯನ್ಸ್ ಸ್ನೇಹಿತರು ಹಾಗೂ ಬಂಧು ಬಳಗದವರಿಗೂ ನನ್ನ ಹಾಗೂ ನಮ್ಮ ಬಾಂಧವ್ಯ ಲಯನ್ಸ್ ಕ್ಲಬ್ನ ಪರವಾಗಿ ಸ್ವಾಗತ ತಿಳಿಸುತ್ತಾ, ನನ್ನ ಈ ಮುಂದಿನ ಕಾರ್ಯಕ್ರಮ ಡಾಕ್ಟರ್ ಶ್ರೀ ಶೇಷಗಿರಿ ಡಾಕ್ಟರ್ ಅನ್ನು ಪರಿಚಯಿಸಲು ನಮ್ಮ ಲಯನ್ ಅರುಣಾ ಸ್ವಾಮಿ ಅವರು ಪರಿಚಯ ಮಾಡಿಕೊಡ್ತಾರೆ. ಥ್ಯಾಂಕ್ ಯು. ಓವರ್ ಟು ಅರುಣಾ ಸ್ವಾಮಿ. ಲಾಂಗ್ ಲಿವ್ ಲಯನಿಸಂ. ಥ್ಯಾಂಕ್ ಯು.
Good evening to all. Today we have a very distinguished personality from the medical field, Dr. T V Seshagiri, amongst us. He is here to give us a talk on organ donation, the truth and myths and its importance, a subject which many of us want to know but know very little about. It's my pleasure and proud privilege to introduce him, a renowned transplant surgeon and andrologist at Glen Eagles Global Hospital, Kengeri, Bangalore. Dr. Seshagiri has high academic qualifications, MBBS from Madras Medical College and FRCS from Edinburgh. He also worked in the UK for 20 years and more. He holds a certificate in the urodynamics from Bristol Urological Institute, UK, and also a certificate in andrology from American Society for Reproductive Medicine. Dr. Seshagiri has varied interests apart from his medical profession. His interest in sports and public awareness. He is the founding trustee of an NGO, Sanjeevani Medical Trust, which provides us free chronic disease prevention program in rural India. He was the first doctor to cycle from Kashmir to Kanyakumari to spread public awareness about healthy living. Such a renowned doctor with so much of academic qualifications of outstanding medical experience. Here I extend a very warm welcome to you, sir, and we eagerly look forward to your much awaited talk. Thank you so much. Welcome.
I wish to say a big thank you to all of you. I consider this to be an absolute privilege to be talking to such a renowned organization, which is one of the largest organizations in the world. To be part of this, you all must be so proud of yourselves. and this is the first time I'm interacting with lions, and I'm hoping that this would be first amongst many more to come. A big thank you to the president, and it's been a pleasure to talk over the last few days to Sundari ma'am and Ramya as well. Um, and I should say, this I don't know if you can see, this arrived just in time today. A lovely bunch of red roses. Thank you so much, all. Um, this talk is basically to try and it's a very taboo topic. There's a lot of misconceptions about organ donation in general, and there's a lot of fear as well, and a lot of it is down to um, not knowing the facts, and knowing some of the what we say untruths. A lot of misconceptions are there. So I will not get too technical into it. If I do, then my apologies. I'm going to try and keep it like a conversation as simple as I can. And as I talk, I've not numbered them as myth 1, myth 2, myth 3. I'm just going to talk about organ donation in general. A lot of it will be, I'm a kidney transplant surgeon, so a lot of it will be touching on kidney transplant, but most of it will apply for organ donation in general. So what I'll do is, if I can carry on, then I will just, I've prepared a few slides, and I will just share the slides so that you'll be able to see it on your screens, and I can, you can hear me talk in the background.
Yeah. You have been made the host. You can share it.
Okay. Okay, are you able to see the slide?
Yes. Yes, sir.
Okay, excellent. Okay, a little bit about myself. I've already been introduced, so I can basically skip this slide. But as most doctors they like to talk about themselves a lot. So essentially, I graduated from here, from Madras, but spent most of my time specializing and working in the UK. I spent almost 24 years there. And I've come back to India the last 5 years. I've been working at Gleneagles Global Hospital in Kengeri as a transplant surgeon. As you know, I'm sure many of you will know or might know, Global Hospital in Kengeri is renowned for transplant surgery. It is what we call a tertiary care providing tertiary center, which has all super specialties, and we pride ourselves in being one of the largest, transplant centers in South India. I've been associated with Global Hospital for the last 5 years, and in the 14 years of its existence, we've been doing transplant for the last 9 years, maybe. And we do all sorts of transplants: heart and lung transplant, liver transplant, pancreas, the works. But our largest number has been in kidney transplants. My department, me and my colleague, Dr. Narendra is a lead surgeon. I've been working with him for the last 5 years. We've done more than 650 kidney transplants, both live and what we call diseased program. And we have progressed over the last, especially over the last 3 or 4 years. We've started doing pediatric transplants, what we also call ABO incompatible transplants, which I will touch upon. As you can see here, kidney transplants are the largest numbers. We've done more than 650, liver transplants, more than 200, pancreas, lung, and heart as well.
Road important. Not speed.
Sir, can you mute yourself, sir? Narayan, sir?
Road problem.
And Narayan, can you mute yourself? So
Okay,
so doctor.
Yeah, I don't need to say what organ donation is. We all know, and that's the reason we are here. I don't need to define it. But the question is, why donate? You just need to look at it not just from our point of view, the donor point of view, but just for a minute. If you look at it from others' point of view, a lot of people are on the register, are on the waiting list, waiting for an organ, be it kidney or lung or liver or whatever it may be. Unfortunately, the sad bit is 90% of these people will die, just waiting for an organ. It's not that, they've received an organ and then they die from the complication. 90% of them die while they're waiting, which really is very sad. That number can be brought down uh, very easily. And I'll tell you how. See, transplant from you may all have somebody in your family who's got kidney failure or liver problems or heart problems and all that, and you may know the quality of life is quite poor. If you look at quite bad. If you look at somebody who's got kidney failure, they're stuck to the dialysis machine. 3 times a week, 2 times a week, or 3 times a week, they have to undergo dialysis, which means they go into a hospital Monday, Wednesday, Friday, or whatever it may be. 3 times a week, they go to the same hospital, same hospital. You know, tie themselves up to a dialysis machine, spend hours there, and then come back home. They are tied to this hospital. They are tied to the city. Traveling becomes a problem. Their water intake is limited. Their quality of life is very poor. And if you look at, once they have an organ donated, if they receive an organ, overnight, the quality of life changes completely. You just need to see that happen once, and then you will realize, my God, what a difference somebody can make to somebody else's life so easily. Um, Biggest improvement is in their quality of life. And second thing is their longevity. Once they receive an organ, obviously they live longer as well. And if you want to look at it from a donor's point of view, be it a live donor or what we call a deceased donor, the live donor, there's a lot of study, there's a lot of science, there's a lot of evidence to show that there are many psychological benefits to organ donation. Okay, being when you donate organ while you're alive, there's a lot of psychological benefits. And if you're dead, if you're brain dead, and then your family agrees to donate organs, they also live. Uh, they are able to cope better. They are able to accept uh, that the person has died, and they are able to move on, um, much faster, and they're also more proud, uh, that they've been able to do this, and they're also happy to know that their loved one lives amongst themselves. So there are a lot of benefits. And basically, looking at transplant, what types of transplant are there? We need to look into these things, as and when I talk. These myths will be demystified. So I'm not just talking about transplant. I'm talking about myths as we talk about, take you through these slides. So essentially, if you look at the Indian setup, Indian scenario, type of transplant is going to be either a living donor transplant or a deceased donor transplant. There are organs that we can donate while we are alive. Kidney is the obvious one, which we are all aware of. We can, although it doesn't happen in India, we can also give one of our lung. We can give part of our liver, part of our pancreas, and part of our intestine as well. And blood donation, tissue donation is also part of organ donation, or blood donation is very common here. Lions, do an amazing job there. Bone marrow transplant, it can also be done. Obviously, for a living donor transplant, the donor needs to give his or her consent. So the second type of transplant or organ donation is when somebody is what we call brain dead. We will touch upon brain dead and vascular dead, so that we understand what it is, because there is a lot of misconception and fear around what brain death is. Uh, So once somebody is deemed to be brain dead, almost any of their organ can be donated. Um, for this, obviously, we need the consent of the loved ones, the kith and kin, the family, as opposed to a living donor where we need the consent of the donor. So these are the two types of organ donation. So we look at living donor transplant. Can anyone from my family donate? Yeah, essentially anyone who has a healthy organ can donate. Okay, as per Indian law, there are what is called as near related donors. So these are the inner circle. The spouse, the child, the grandchild, parents, grandparents, and siblings. So sort of a first degree relatives is what, as per the Indian law, is called the near related donors. These people can donate organs. The what we call the next circle, or what is defined in the Indian law as other than near related donors, is uncle, auntie, in-laws, friends, colleagues, and it goes on like that. So they can also donate. Okay. Legally, technically, they can also be donors. What happens is when somebody decides to donate, say, for example, their kidney, let's say they've got a loved one in the family who needs a kidney, and then somebody has come forward and said, okay, I want to give this to my brother, give the kidney to me. What happens then? They basically, approach a hospital, and then they provide, documents showing, that they are related, all sorts of documents, Aadhaar card, PAN card, bank statements, photographs, marriage certificates, birth certificates, whatever it may be. The police will be involved for various sort of clearances as well. And then the whole thing is put through a government appointed authorization committee. So they scrutinize these documents. See, the scenario in India is, there's always been this, this feeling that many of these organ donation happens not out of love or affection, not for altruistic reasons, but for some benefit. There may be some benefit, commercial or otherwise, for the donor, and that has been the case in many cases, and that has been the fear as well. When that happens, that is where these government appointed authorization committees come in. They scrutinize these documents, and then they have to authorize. Before the surgeon can do the surgery, they have to authorize, saying that, okay, we are happy that there is no benefit to the donor. And at this stage, it can even get rejected. There have been scenarios where the donor has given the kidney, there has been middlemen involved, there has been money exchanged and all that, and there has been, he might have promised, I'll give you so much, and he didn't give that much, and then he gets upset, and by the time the surgery's happened, and then he goes to the police. So there's been a lot of this happen. There's been a lot of racket. As a result, there has been a lot of reluctance on the part of surgeons to get involved in what we call other than related donors as well. I'm not saying it doesn't happen. We still do. There have been instances recently in Bangalore as well, where we have done surgeries on not the first degree relative. One doctor has given to another doctor as well. But then the committee has to approve. The committee has to say, okay, we've scrutinized, we are happy, there is no money exchange, there is no benefit involved for the donor. Once they do that, we go ahead and do the surgery. So who can donate in a living donor program? Well, essentially the answer is anyone who has a healthy organ can donate. There are certain conditions where we say we take precautions and we say not to donate. One is, obviously, if their organ is diseased. If they've got kidney failure, obviously they can't donate their kidneys. If they've got previous heart attack and they've got heart failure, they can't donate their. So obviously they have to have a healthy organ to donate. But if they've got severe mental illness, then it becomes difficult for them to donate. One. Second is if they've got HIV or hepatitis, then it becomes a little bit more tricky because we have to tell the recipient that this is what it is. We can still sometimes go ahead and do it as long as the recipient agrees, and the recipient will need to be on lifelong therapy or the appropriate therapy. But these are tricky situations. When brain death happens, basically, anyone is a potential donor. Um, I won't go into, see, one of the misconceptions. This is sort of a crowded slide. Don't try and read too much into it. Essentially, we say that the group has to match. If the donor is A positive, the recipient has to be A positive. Generally speaking, yes, the donor and the recipient, if they match, we can easily go and donate. But more recently, we have started doing what we call mismatched donor as well. See, the blood group, the system that we use for blood grouping is called ABO group. So ABO compatible recipient and donor, the outcome is very good. But we have started. We've done about quite a lot. I think near to 18 or 19 ABO incompatible. So when the donor is, say, B positive and the recipient is A positive or O positive, we can still go and do a transplant. It's just that the recipient, there are techniques where we use to reduce the risk of rejection. I will briefly touch on that later. But ABO incompatible, they don't have to be the same group, is what I'm trying to say. Because again, there is that misconception that the group has to match. No longer. Even a mismatched blood group can donate. So this is what I was saying. Can mismatched blood group donate? Yes. There are methods where we do what is called desensitization and plasmapheresis and all that, where we reduce the risk of rejection. So the outcome is almost as good as matched blood group. Not every hospital does that, but we do it in BGS Global Hospital. So what happens to the donor after they donate an organ? Here I've sort of put the points. Data is to do with kidney, but this is sort of very similar to the other organs as well. So once I donate the organ, what happens? Well, when I donate the kidney, I obviously undergo an operation where my kidney is removed. It is done through a keyhole, laparoscopically. If it is a liver, then it is done as an open operation. Part of the liver can be removed. Stay in the hospital depends on what organ is being donated. For a kidney, it's usually about 4 or 5 days. Day 1, they are eating, talking, and walking. Day 2 and day 3, all the tubes, catheters, drains are out. Day 4 or day 5, they are discharged. What sort of, do they need to? These patients, we advise that they have some sort of follow-up with a physician, with a nephrologist, or an appropriate specialist, for years to come. Most donors do not, continue leading. Significant majority of the donors continue leading, healthy lifestyle. There are no restrictions that they need to undergo. But we do advise, at least for kidney donor patients, we do advise that they have a follow-up with a nephrologist once a year, where we'll just do a urine test, a blood test to check their kidneys and check their blood pressure as well. Because there is, these patients have been followed up for 15 to 20 years, and studies have shown that depending on what study you quote, between 3% to 4% of donors may develop, high blood pressure after many years to come. So that is the reason. Again, 97% of donors will, this does not happen. Any restrictions to lifestyle? Not particularly. We always give the usual advice that we give for anyone who wants to lead a healthy lifestyle: regular exercise, reduce salt intake, and a healthy diet, just like for anyone else. Pregnancy after a donation, can the lady become pregnant? Yes, but we usually say wait for at least 6 months. Moving on to a deceased donor transplant. Given the Indian setup, there has been, as we discussed, the live donor program is not ideal given our setup. So there is a push to try and develop the disease donor transplant. Disease donor transplant is where the donor is brain dead. So this is what the government and NGOs and the doctors are giving a push for. See, there is a huge need if for organs in India. If you just look at kidney alone, we need about 2 lakh kidneys, and we get only about 6,000 of those. So you can see that there is a huge, 2 lakh patients need an organ, and this is just kidney alone. There is a huge gap in demand and supply, and this gap can be reduced significantly, but that is down to us. So why is there such a huge gap? Why is there a shortage? See, first of all, even if we say, let's say, I go on the register, I say I want to be an organ donor when I die. Even if I have a organ donor card, I've signed whatever paper and all that. Still, after my death, my family has to give consent. The doctors cannot take organs from me if my family does not consent, although I am on the register. And it is this. They are already grieving. They're already, in a bad state of mind. They've just lost a loved one. And at that time, to say, we want to cut them open and we want to take out all the bits, it's a very difficult thing to accept. So that is something that is one of the main reasons why there is a shortage. I'm not saying that's good or bad. I'm just stating facts here. And there is a lot of lack of awareness about what are the ethical dilemmas around it, what are the legal implications. Will the body be disfigured? Will this delay, the burial or the cremation or whatever it may be? There's a lot of fear and misconception around it. And with culture and with the religion, certain religions, there are certain restrictions as well. So these are the reasons, broadly speaking, why there is a huge gap. This next 1 or 2 slides may be a little bit heavy, especially for for this time of the evening, but just try and bear with me. The whole idea of trying to talk about myths and trying to break misconceptions is to go a little bit heavy. Unless I do this next 2 or 3 slides, my talk will just fall flat. So if it is a little bit heavy, please bear with me. We have to understand what brain death is. See, when we say death, there are 2 types. There are 2 stages. There is what we call the brain death and what we call the vascular death, the blood flow death. Brain death is when the brain stem, basically the brain stem controls the consciousness, the breathing, some of the functions, gag reflex and things like that. Brain stem is absolutely essential for life. When somebody has brain death, that means their brain stem is no longer functioning. That means they have stopped breathing. That means they need to be put on a ventilator. So as long as they are on the ventilator, they will keep breathing. One. Second is, even after brain death happens, blood flow continues. For many of the organs continue to live. The organs continue to live because there is blood flow and there is oxygen that is being carried around. There is glucose that is being carried around. So as long as that is there will be life in these organs. Okay. So when somebody is brain dead and when we put them on a ventilator, the ventilator breathes for them. So as long as that ventilator is breathing for them, the circulation, the oxygen, everything is maintained. So as long as the ventilator is switched on, the organs will continue to remain alive. This is the stage when we can, and brain death is irreversible. Brain death is different from coma. Coma is a deep state of unconsciousness which can be reversed, whereas brain death is an irreversible process. So they've got into a stage of brain death where they cannot come out, but their organs are still alive So this is the stage where we can go in and retrieve the organs and help other patients on the register. Common causes of brain death. The most common cause in India is road traffic accidents. We get a lot of young, unfortunately, young men and women, involved in two-wheeler road traffic accidents, not wearing their helmets. Four-wheelers not wearing their seat belts, and they are brought in, or they are brought. They come to the hospital, and at some point of time they are declared brain dead. The other causes of brain death are bleeding. When they bleed into their brain, or cancer in the brain. These are all sort of common causes of brain death. What is the process? What happens when the doctor? So this patient has been admitted. He's been put on a ventilator. And then we feel that there may be brain death. So what happens then? What next? I'll just take you through the process a little bit. See, there are certain conditions that can mimic brain death. Even simple things like hypoglycemia, low glucose, what we call hypo in diabetics. So that can mimic brain death. So, something like they may be, heavily alcohol intoxicated. They may have had drug overdose or poisoning. These are all things that can mimic brain death. So the doctors will make sure that these are not there, that the patient is not suffering from any reversible condition. So we rule out all that. And then we will do certain tests, certain exhaustive tests to confirm that he is brain dead and he is irreversibly brain dead. So those are quite exhaustive tests. Once that is done, then we will speak to the what we call grief counselors, bereavement counselors. They will go and talk to the family. They will talk to the family, the next of kin, and say, listen, this is what is happening. The patient is brain dead. He is in an irreversible state of death. He is alive only because he is on the machine.
Okay.
If we switch the machine off, he will be brain dead. He will be completely dead. But there is an opportunity to retrieve organs, and then we counsel them. We, as in not we doctors, but the bereavement counselors, grief counselors, talk to the family and counsel them. And then it is up to the family to decide, yes, we will consider organ donation, or no, we don't want that. So that is a decision, and that decision they have to take, and that decision will be respected. Nobody tries and influences them. Once they decide to donate the organ, then then the surgery for retrieval is done, and organs are retrieved. The transplant surgeons per se are not involved in treating this patient or in the process of declaring brain death. They are nowhere in the picture. Obviously, there is a conflict of interest. So in this scenario, there will be two doctors and two other doctors or management, what we call medical superintendents, and the admitting doctor. There will be a specialist neurologist or a neurosurgeon. There will be an intensivist or a respiratory physician. So these are government authorized doctors who do exhaustive tests before they declare brain death. In fact, they do the tests with a gap of few hours in between. So they'll do it twice. Once the decision is made, then the patient undergoes surgery for retrieval. So what are the organs that can be retrieved? Once the brain death has been done, all these organs, 2 kidneys, the liver, and liver can be given half and half. Lungs can be given to 2 people, but in India, we give both lungs to 1 patient. So 2 kidneys, 2 livers, 2 parts of the livers, lungs, heart, pancreas, eyes, all of these things can be retrieved. So you can imagine how many people's life can be changed. Massively. So that is a list of organs that can be retrieved. So easily, when one brain dead person's family decides to donate his or her organs, 8 to 9 lives can be saved, and more number of lives can be improved. Things like skin grafting, corneal transplant, eye transplant, and things like that. So there is, there is a lot of good that can happen from that brain dead person. So now, from the talk itself so far, I'm hoping there are some myths that I have busted, but I have put certain specific myths 1, 2, 3, and 4 to try and sort of break those myths as well. So one of the things is about brain death. What if I recover from brain death? People may think, you think I'm brain dead, but what if I recover? No, as I've explained, brain death is irreversible, and a set of doctors in India have to certify brain death, and they certify it twice with about 6 hours in between. And these are exhaustive tests. These are not just tickle here, tickle there, press to see for pain reflexes. These are proper tests, where the ventilator is stopped, ABG, what we call arterial blood gas analysis, is done. So these are proper detailed tests are done. So once you're declared brain dead, there is, you will never recover from it. Other thing is, how do they really know that I am dead? So again, my explanation should have answered that. It is a exhaustive test that we do. I think next question is, how could the organs of a brain dead person be used? The person must have some life for the organ to be usable. We've already discussed this. I've already explained this. Brain death happened, but after that, circulation still happens for a varied period of time. And as long as the patient is on the ventilator and breathing, oxygen circulation will be there, glucose circulation will be there, organs are viable. But the other thing we need to remember is, once the organs are removed, there is a certain period of time within which we have to put them into the donor, into the recipient. So that period varies from about 6 hours to 24 hours, depending on the organ that is used. This again, I want to explain this as well. Is brain death same as coma? No, coma is a reversible condition. Coma is where the patient is in a deep state of unconsciousness. He or she is usually breathing by himself spontaneously, and coma, in many conditions, unless they deteriorate, coma is a reversible condition, whereas brain death, if certified, is irreversible. I'm coming to the end of the talk. Just another 3 or 4 slides. We all have a responsibility to ourselves, to our loved ones, to the society as well. I think none of us are kids. We're all mature. We I'm not saying kids are selfish, adults have to be selfless. I'm not saying that. But as adults, as responsible citizens, I think we owe to society. I may or may not be wrong. That is my belief. I think my belief is, each one of us owes something to society. And the best way to give back to society is, there is no other noble way, there is no other way we can give back to society, where, this is the best way we can give back to society. There is no other noble or better way we can give back to society. Again, yes, there are always scandals. There will always be rotten apples in the basket. But unfortunately, when a scandal happens, that gets more publicity. I'm not saying we need to, brush under these. We need to brush these under the carpet, or we should hide these things. No, not at all. I'm not saying that. But unfortunately, these are the rotten apples, and when one of the such thing happens, all of us get painted in the same brush. Media has a responsibility as well. Just like they report scandals, they should report positive. There's so much good being done, not just by doctors, by people who are donating organs. The media has a responsibility to report these as widely, if not wider, than they report scandals. So we all have a role to play. The aim is to raise awareness. The aim is to try and help the situation. And given the situation in India, uh, disease donor program is where the benefit can be more. So that is why we are all, we don't stand to gain anything. There are NGOs, there are organizations, that are pushing for this, quite rightly so. I've got a few points here. I don't know where to fit them in. So I've just thrown these, sort of individual points here. Anyone can be a donor, regardless of their age and gender. As long as their specific organ is healthy, they can donate. And what you need to understand is, if you are admitted to any hospital, I'm not just saying about BGS Clinicals Global Hospital, any hospital, the number one priority is your life. We're not looking at, when somebody comes in, oh yeah, we've got 2 kidneys, 1 heart, 1 liver. No, we're not looking at people like that. The priority when you get admitted, the priority is your life. So that, people need to understand that and trust. And as I said before, even if the donor has the deceased person, the brain dead person has a donor card, in Indian setup, the family's consent is needed. And the other thing is, the family or the donor does not have any responsibility for costs related to the donation. They will not be charged for the donation as it is. So I'm just going to close with this slide. As I said, we all have a responsibility to give back, and I think as grown-up individuals, as mature people, we need to make up our own mind. We need to take the good, the bad, whatever it is the media offers, whatever it is the doctors, NGOs, people, government, whatever it may be. We need to take it all in. We need to make up our own mind. Do I want to be a donor when I'm living? Do I want to be a donor, if it comes to it, when I'm brain dead? And then when we decide that, we should have a discussion with our loved ones, because we have a responsibility towards them as well. And we need to have that discussion. And we need to understand that we can live on in others even after we've gone. And that actually helps even the next of kin, even the family, to cope better with us going away, with their loss. So on that note, I want to say a big thanks again, to all of you for having given me this opportunity. It's not an easy topic to talk. It's not an easy topic to listen. And if it's been a little bit heavy, I'm sorry, but I had to do it. So again, thanks again for the opportunity and for these wonderful roses. I'm more than happy to take questions.
Thank you, sir.
Let me just try and come out of this screen.
Any questions? We have our DC for organ donation line, Paul Prakash, over here. Welcome, sir. Anybody would like to pose any questions to the doctor? Dr. Seshagiri, please. It was a very informative and impressive doctor from Venkata Shiva Reddy.
Hello.
Can I ask you a question?
Sir, Prakash sir, welcome, sir.
May I please ask a question?
Yes, please.
Yes, my question is, sometimes we hear that some patient who has had a lot of brain hemorrhage is put on ventilator. Is that right, that the patient should be put on ventilator at that stage? Or if the patient is put on ventilator, In what way does it help the patient? May I please know this?
Dr. Seshagiri, sir,
Yes.
you have to unmute yourself. Is there?
Yeah, sorry.
Yeah.
Yeah, that's a good question. See, when a patient comes in, see, bleeding can be from various reasons. It may either be from just a hemorrhage, where because of high blood pressure, what it may be, some of the medicines he or she may be on, or it may be from injury, trauma, road traffic accident. But during the assessment stage, once the CT scan or the MRI is done, depending on how big the bleeding is, they will be ventilated, because there are certain bleeds, there are certain hemorrhages that can be controlled until the initial assessment is made. Hello?
Yeah. We
Yeah.
can hear you.
Yeah, so till the initial assessment is made and the decision, till the decision is made to see whether the bleeding can be controlled or not, we will have to obviously keep him or her on the ventilator. Because there are certain hemorrhages, there are certain bleeds which can be stopped by various techniques, by surgeries or what we call embolizations. They can put coils and those sort of things to stop the bleeding. So obviously some of them will improve, some of them will not. They will continue to bleed. But unless we do that, we will never know. Until that decision is made, till that attempt is made, we will have to keep them on the ventilator. And again, it is a decision that is taken in discussion with the family. The family might say, it's not a sort of a blanket decision. It has to be discussed with the family. Family might say, other parameters may come into the decision-making process as well. They might say, well, he's 86, he's already had 2 strokes before, he's been suffering a lot, we don't want to do anything. So those sort of patients, we don't do anything. We don't put them on ventilator, we let them pass away. So they might even take them back home. So not every bleed is put on a ventilator.
Can I ask a question?
Yes. Yes, Ramya.
Doctor, you were telling about coming in of an accident case where if there is a brain death, then you talk to the family about organ donation and such. So will that happen? Can that organ donation be done even if the say the brain dead donor is not on a donor's register with the consent of the family? Can that be done?
Yeah, absolutely. See, in India, very few people actually go on the register. See, irrespective of whether he is on the register or not, it is always discussed with the family.
So it can be done with just the family's consent then?
Yes.
May I ask a question?
Yeah.
Doctor, is there any possibilities for the patient to recover also from this?
Brain dead, you're saying?
Yes, sir. Yes, ma'am.
I think it is yes,
Brain damage. No, he was one of my niece. No, he was being kept in the Manipal hospital almost for 10 days. But after that, then they declared him as dead. So that's the reason I was asking you. There is no possibility at all for them to recover?
No, I didn't get your question fully. So you said one of your relative was kept in Manipal hospital?
The Manipal hospital, because he had a brain damage or something like that. And he was treated really for more than a week.
Of course.
After 10 days, then they said, no, he's dead. So if there is any possibilities like this, for why he could not able to recover, that he has been given all best treatment.
Okay. See, once the patient has been declared brain dead, they do not recover. The whole definition of brain death is it is irreversible.
Okay.
They are not going to survive. So see, there are instances where where we declare patients to be brain dead, and then we discuss with the family. Then they say they will decide this way or that way. Sometimes they will decide yes or no, finished. Sometimes they will sort of 50-50, and then 1 day, 2 day goes on. Sometimes they will decide to donate, and then the next day, while all this process is going on, suddenly they'll change their mind as well. So for various reasons, even after a patient has been declared brain dead, they are kept on life support machines till the family. It's the family's decision. See, they will say no, today is maybe Thursday, whatever puja gija, we want to die, keep him alive for another day. So many things come into play.
Okay.
So it's the family. Once the decision has been made, once the patient has been certified brain dead, it is up to the family to decide when they want to switch him off.
Oh, thank you, doctor, for the clarification.
Not at all. My pleasure.
Anyone else? Madhvi, you have to unmute yourself. Madhvi.
Doctor, I have a doubt. You said that any age person can be donate the organs. So can the 80 years aged old guy or lady can donate the organ, or below 5 years baby can donate the organ? The another question is that the cancer patient can donate the organ.
Okay, I didn't hear the last bit. I heard the 80 years and the 5 years. What was the last bit?
Cancer.
Cancer patient. Yeah, okay. Yeah, 80 years. See, there is no age limit per se for organ donation. As long as the organ is healthy, even a 80-year-old, if say 80-year-old heart or lung may not be healthy, but if the 80-year-old's kidneys are healthy, and if the family want to, then they will look at various parameters, all sorts of tests to assess kidney function, and there is no reason why that kidney cannot be retrieved. So age per se is not a cutoff. Medical condition is a cutoff. If that patient has had diabetes for a long time, that obviously will affect the kidney, can affect the heart, can affect the eyes and things like that. So medical condition is what dictates whether one can donate or not. And cancer patients, see, generally speaking, we do not take organs from cancer patients purely because, especially if it is advanced, what we call the cancer has spread elsewhere, because we don't know about what we call micro spread. CT scan and this and that may be normal, may show that there is no spread of cancer elsewhere, but we don't know about micro cancer spread, and some of these patients may have mutation, may have some genetic issues. So generally speaking, cancer patients we don't take. The only organ we can take from cancer patients is their cornea after death. And the other thing is, somebody who dies, if they've got brain death and they've had brain death, say from severe sepsis, severe infection, those sort of patients we don't take organs, even if their organs have been previously healthy. Severe sepsis, severe infection tends to sort of go into the body all over. So those sort of patients we don't take the organs.
Thank you.
Madhvi, you wanted to ask something?
Can I ask once more?
Yeah,
Madam?
Yeah.
Yes, sir. Sir, you said that availability of kidney, the proportion of kidney required and the availability, there is a drastic, gap. And now, we also know that awareness is very important regarding the organ donation. Now, like we are, having this kind of a session and we know some information about it, and we may talk about it to our family, friends, etc. And we can, urge them. But, by and large, what I feel, supposing if this kind of an issue is introduced in the curriculum of our schools or colleges, maybe awareness will spread to a larger extent. This is my point. Can this be done, sir?
I think that is an awesome point. see, there are a lot of things that many countries are attempting. We came back to India only 5 years ago. So my kids were studying in the UK, and you hit the nail on the head. For my daughter, who was just in when we left, I think she was only in second or third. Organ donation was already a chapter there, in addition to various other health issues. So you are absolutely right. That is something that needs to be introduced here. I think that is being already taken up by one or two NGOs with the. I know it is being done in Tamil Nadu. It is being at a fairly advanced level of discussions. Here, I'm not sure, but I think this is something for me. It's going to be one of the take-home messages, take-home points to sort of work on. So thank you for that, because end of the day, that is where we can make a difference. If we can't make a difference in 2 years' time, at least for the next generation, we can make a big difference. Yeah, so many countries are implementing this, and while you made that point, while you make that point, another point comes to mind is one of the other things that many Western countries are doing is here we have an opt-in system. So if you want to be a donor, you have to opt in, or your family has to opt you in. Whereas in the United Kingdom, in one part of United Kingdom, in Wales, about 2 years back, they made it as a opt-out system. So everybody by default, everyone that dies brain death is on the register. So if you want to come off it, you actually have to sign papers while you're alive. So many governments are doing that. So that is something I wanted to share as well. So, but ma'am, yes, yeah, thank you so much. I've made a note of that. So that is something I will look into.
Thank you so much, sir.
So supposing we want to have this program in schools, can you make a simple version, something like, which is easier for the children to understand?
That is a very nice way of saying this has been a very complicated version and very painful.
No, not for us. It's sorry.
No, not at all.
But somewhere, some kind of a demo or a play acting or something like that. Some other methods.
Yeah, definitely.
Because some parents might object to these points being discussed in schools in India. So
no, absolutely. I'm more than happy to take this point further with your club itself if you want to. I can even think of a school I can get in touch with. See that the schools, we have to make a start somewhere. What we'll have to be looking at is coming up with very simple versions. Maybe use
puppets,
taking out and putting stuff in, just like toys. I think that's again a fantastic idea. I'm more than happy to reach out to you, ma'am, and we can rope in a few schools or start with one school and see where it goes.
Okay.
I've got a very good understanding with one of the international schools where my kids are studying. They're very proactive when it comes to these sort of things. So I'm happy to take this forward.
Okay. I think we'll think about it, doctor. We'll work on it. Yeah. Anyone else? Madhvi, you wanted to ask something. Can't hear you.
I have a doubt. Can you hear me now?
Yes.
Okay. Suppose the person has met with an accident and he's brain dead, and he has nobody to claim his relatives or anything to get a concurrence. Will the government or the panel still decide to take up with organ donation of that person?
No, in a Western country, we will have to go to court for that. Okay. We can go to court and get a judge to sign a paper and say yes. But in India, we tend not to do that.
There are legal problems.
Yeah, legally, it is seen as the hospital benefiting. So most hospitals would not go down that road.
Okay.
There are a lot of practices. I know this is being recorded, but in few countries they do all sorts of things. In China, I mean, this is a whole. It opens up a can of worms. In China, I think. Don't send this video to any Chinese government official. I'll be shot dead. I think. I think in China, the people who are on death row, who are about to be executed, they basically, they basically take everything out of them and then execute them. All the organs are whatever can be retrieved is retrieved. Yeah, I know. So ethically and morally, it opens up a lot of very difficult, questions to be answered. So no hospital will go down that route.
Thank you, doctor.
I've got a question. Can I?
Yeah.
First of all, thank you, doctor. It was a very insightful session. My question is, let's say somebody has donated kidney or heart. What happens if the recipient's body rejects that organ? Are there cases like that? Will there be a death of the recipient also in that case?
Yeah. Okay. There is. See. Okay. I'll talk about kidney because I know the numbers. As far as kidney goes, well. Let's look at somebody where somebody has received a kidney from a live donor. Say, brother is given to his brother. Brother is given to his sister. So that is a live related donor. The chances of rejection, what we call rejection, is when the sister's body does not accept the brother's kidney and it rejects it. It will form antibodies, reject the kidney, so the kidney doesn't work properly. So the risk of rejection in a live related donor in kidney is about 10%. Okay, so if we do 100 transplants, 10 of them will show signs of rejection, as in they may not make urine, their creatinine or blood kidney parameters may not come down, so kidney function may not improve. So in those sort of situations, if it is picked up early on, out of this 10% rejection, out of those 10 people, 9 of them can be saved. So in 9 of those, the rejection can be stopped. But it has to be found out early on. So that is why we are very particular about the recipient. His quality of life improves a lot because they are no longer hooked to a dialysis machine. They can eat and drink much more than what they were used to. They have no fluid restrictions. Prior to that, they can drink very little. So their life changes, but they need to be on lifelong medication to suppress, to stop this rejection. And some people, they lapse. They don't take it. If we say take it every day, they take it for 5 days, 4 days, and then because of money and so many other things, they don't come for follow-up. In those sort of cases, when rejection happens, it doesn't get picked up. If they don't keep coming for follow-up, it does not get picked up. So the whole point that we tell the recipient is you keep coming every 3 months, 6 months, 6 months, 1 year, 1 year, 1 year, is so that if a rejection happens, we can pick it up early and treat it. I don't know if that answers your question.
Yes, it does, doctor. Thank you so much.
Yeah.
Percentage of risk in the donor, doctor?
Donor, again, I can talk for kidney donor. As I said, they've been followed up for 15, 20 years. Long-term follow-up is there. The only thing is a small percentage of them may be prone to develop BP, high blood pressure. Apart from that, there are no risk per se from donating. Again, that risk, the chances of a donor developing BP after 15 years is between 3 to 5%, depending on what. Again, so if you look at 100 donors, three, 4 or 5 of them may develop high blood pressure 15 years later. So that risk is very minimal.
Well, it's been very interesting. Anyone else? Any questions? I can see a lot of silence. I think it takes a lot of time to assimilate this whole subject. Rajini ma'am, can we ask our DC for organ donation and Paul Prakash to say a few words? Oh, Kumar Swami, sir, you want to ask a question? Yes, please go ahead. Yeah. Unmute yourself.
Madam, I will ask the question in Kannada, madam.
Huh. Yeah, I hope he understands.
Donation, madam. Poor people cannot afford this.
Donation?
Organ donation, madam. ಬಡವರು ಮಾಡ್ಸೋದು ಕಷ್ಟ ಆಗುತ್ತೆ ಮೇಡಮ್ ಬಿಕಾಸ್ ಆಫ್ ಆಫ್ಟರ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟಿಂಗ್ ಸೊ ಮೆಡಿಕೇಶನ್ ಇಸ್ as a doctor told medication is required and only rich people those who are affordable they is my knowledge don't mistake especially in our country. This is what happens present days. It's happened. Those who are affordable, they are rich.
Those who can. What you want to say is, poor people cannot afford.
Yes, madam.
Donations only the rich can afford to get a donation because.
Yes, madam. Family friends they will donate the organs because of too much medication. After that, they can't.
You're saying the follow-up and cost of medicine cannot be.
Yes,
it's not affordable to the poor person.
Yes,
what does doctor say about it? Dr. Seshagiri, sir?
No, actually, on the contrary is true. See, if you see somebody who's not undergoing transplant, if you look at them, they spend on dialysis. Dialysis, you are paying, it may be small, but you are paying it 2 or 3 times a week. So you're paying it 8 to 12 times a month. And dialysis also, you're still taking medicines. It's not that you don't take medicines. You will still be on medicines for whatever has caused the renal failure. So if you look at it in the long term, transplant, I'm talking about kidney transplant works out cheaper. Because, kidney transplant, depending on which hospital you have it in, it will cost you only between, say, 4 lakhs to 5 lakhs, 6 lakhs, depending on blood group and all that. So if you look at dialysis, it is much, much more. Over a period, if you calculate it even over a period of 3 to 4 years, not long, it works out to much, much more. I've had 2 people in my family who've donated, and 1 person in my family who's received a kidney. So 1 person donated his, one was a cadaver donation, so brain dead, he donated his everything, that one. Second is one person, one of my uncle gave his kidney to another one of my uncle. And we could see cost and quality. Cost was a drain. Cost is a massive drain on the family.
Yes, sir. That is the.
No, I'm talking about dialysis.
Dialysis
cost is a big drain. Transplant is, kidney transplant is not that expensive, sir. Liver is expensive. I agree. Liver, if you go for heart, liver, those will be 20 lakhs, 25 lakhs. And depending on what it is being done for, it will go up to 30 lakhs, 35 lakhs. So that, not every one of us can afford. I totally agree. Point taken. There is no argument. Kidney transplant, there is no question. Transplant is much, much, much cheaper.
Oh, yes. Thank you.
Line Dr. Paul Prakash. May I invite you to say a few words? Line Paul.
Prakash sir. Paul.
He's there.
No, he's muted.
Hello,
He's
sir.
talking. He's muted.
He's muted, but he can unmute himself.
Hello.
Yes, sir. Please go
Can
ahead.
you hear me?
Yes, sir.
Yeah, there are so many.
We can hear you loud and clear, sir. Please go ahead.
Doctors have already spoken and given a very good. Am I clear?
Yes, sir.
Yeah, Dr. Seshagiri had given a very good informative, and most of the information is already given. And what I'd like to say in general, people can donate when they're alive or maybe after death. Of course, it is there. And there was a person who lost his eyes, and then this parents have donated his eyes and they implanted, and the person can see through the dead body. The person who gave his
Beyond
eyes,
death,
yeah, he can see now. He gave a life to another person who was completely blind. So many incidents are happening around. There are so many myths and facts, and so many people are talking, like people are talking when you are dead, without any, you'll be having no kidney, no eye. And it's a fault actually. It's a mistake, and people just give a talk like that. But when you're born, the Vedas says very clearly that the body is made out of mud, body will go back to mud, but the spiritual there's no incarnation, so called. You can take a birth again, but it will be in the spiritual thing. So whether you lose any organ, anything like that, and nothing bothers anything, nothing happens anything. You can be alive once again. Then of course it is called there is a judgment, and then of course hell or heaven, so on. It goes on like that. So I, as a organ, for organ donation, I request people. You have heard many points, many good things from the Dr. Seshagiri. Please do not burn from the wood or from electricity or current death, or don't try to bury your body in the mud, because everything is lost. They'll give you a pot of ash both the side, and then you go to the mud, and then all the worms and germs, and they'll eat up and you're finished. But you want to live, really want to live, please donate your organs and make your organs to live, may you live. So this all I wanted to say it out. We are making some pledge cards and other thing very shortly, and we would like to invite each and everybody. We would like to ask everybody to donate and say that through your organs you can live, and you can give life to many people. Long live Lionism. Thank you, ma'am.
Thank you, Dr. Prakash. Thank you so much, sir.
Okay, sir.
Thank
you, sir. Thank you, Prakash, sir.
Yeah.
Thank you, ma'am.
Ramya.
ಯಾರಾದ್ರೂ ಕ್ವಶನ್ ಕೇಳೋರು ಇದ್ದಾರಾ?
ಇಲ್ಲ, ರಮ್ಯಾ vote of thanks ಹೇಳಿ.
ರಮ್ಯಾ?
I request you and Ramya to propose the vote of thanks.
Vote of thanks. Ramya ಹೇಳಪ್ಪ.
Good evening, everybody. Presiding officer and my dear friends. I deem it an honor and privilege to propose a vote of thanks on this occasion. First, I would like to thank our club president, Lion Rajini Umapati, for hosting and conducting this meeting. I would like to thank our special guest and speaker, Dr. T V Seshagiri, who, despite his busy schedule, has found time to grace this occasion. And I'm sure his erudite talk about organ transplantation and donation has dispelled many of our myths and motivated us to think about the very noble act of donating organs. And so you have put it in a very simple manner for all of us to understand. I'm sure it's a very big topic, and I'm sure it's a very very heavy topic to understand, but still you have made it very clear to all of us. Thank you very much. A special thanks to our DC for organ donation, Dr. Lion Paul Prakash Kumar, for his support and valuable comments. I also would like to thank Lion Nagmani ma'am. She's not here. I'm sure she is busy in another meeting, but Lion Lavanya is here on her behalf, and she has really asked some very good questions. Thank you very much, Lavanya ma'am. I would like to thank all the club officers, members of LCB, Astia, Birds Paradise, and members of other clubs who are present here along with us on this occasion. A big thank you to all the guests and invitees present for making this a very grand success. I thank Lion Sundari Venkatachalam for hosting this Zoom meeting. Thank you, ma'am. Thanks to all my fellow club members for sharing the info and being present here. Thanks, one and all.
Thank you. Thank you, Ramya.
Thank you. Thank you
very much for
Thank you,
giving
Ramya.
to have
Yes, sir.
a good, useful.
Dr. Seshagiri, sir. Thank
Thank
you.
you, Saraswati ma'am. Thank you. Please pass on the message. Thank you, sir.
Again, thank you all, for this wonderful opportunity. I just hope,
We meet again.
Yeah, I just hope it wasn't too heavy. And
No,
I
sir.
hope to meet again. And as I said, I've got a couple of take-home messages, so I'll be in touch, and hopefully some good will come out of all this. Thank you so much.
Thank you so much. Thank you. Thank you very much.
Thank you very much, sir.